Hello, welcome to our special live streaming series, COVID-19 Frontline on CGTN. I'm Zhou Yun. COVID-19 Frontline, the special live show which offers a platform for medical experts from China around the world to share their thoughts and experiences in fighting and containing COVID-19. And apart from expert discussions, we also take questions from our followers on various social platforms, including CGTN app, the official website, CGTN official account on Facebook, YouTube, Twitter, and Sina Weibo. So feel free to leave your comments and questions with the hashtag of my opinion on COVID-19. We look forward to hearing from you. And today, our guests are from China, Canada, and also Zambia. And now it is my great honor to introduce to you all of them. Well, first of all, we have Professor Zeng Lingxia, who's a professor from the School of Public Health of Xi'an Jiaotong University. Thank you so much for joining us, Professor. And also, again, it is our great honor to have Professor Shi Bingyin back with us. He's the Dean of First Affiliated Hospital of Xi'an Jiaotong University and also a very frequent guest of our show. And also we have Mr. Chen Zhijun, who's the Deputy Director of CDC in Xi'an. Thank you so much for joining us, Director. And also we have Professor She Junjun, who's the Professor of First Affiliated Hospital of Xi'an Jiaotong University. So thank you so much for joining us. And also we have some international guests joining us today as well. First of all, we have Dr. Michael Bambiko, who's the President of Zambia College of Medicine and Surgery. And also we have Dr. Jonathan Kaunda, who's the Chair of Trainees and Fellows Committee from ZenComs. And also we have Dr. Jonathan Stella, who's a Registrar of Zambia College of Medicine and Surgery. We also have several other professors joining us from different parts of the world. They are Professor Liu Mingyao, who's the Director of Institute of Medical Science from the University of Toronto. Thank you, Professor, for joining us. And also Professor Wei Xiaoling, who's a professor from the University of Toronto. And also Professor Wang Peizhong, who's a professor from the Faculty of Medicine from Memorial University of Newfoundland. And also Professor Zhang Weihong, a professor of Ghent University. And finally, I would like to give my special thanks to Mr. Liu Zhao, who's the co-director of Belt and Road Joint Research Center of UNZA, for your generous help, for your generous support, and also for making today's dialogue possible. So thank you so much, everyone, for joining us. And without further ado, I would just like to kick off the floor to our guest. So first of all, how about we have the friends from afar to raise their questions. So Dr. Stella, if you have any question, yes, please feel free to go ahead. And now, because all the guests are muted, so every time before you speak, please kindly turn on your audio. Dr. Jonathan Stella, yes, do you have any question here? You need to turn on the audio because now you're muted. Okay, now it's good.
Yes, hello, good afternoon, everybody. My question really is to the panel with regards to where do we see the role of training, of education in this era of COVID, vis-a-vis the use of online platform for education. Thank you.
Okay, thank you. So let's see. Dr. Shu, who do you think could answer this question? Because your audio is a little bit low, Dr. Stella, do you mind asking the question again, like in a little bit louder voices? Thank you. I'm sorry for that.
Sorry for that. My question is from the background where we have COVID, especially for third world countries. Now, this has meant challenges with regards to training. Issues to do with social distancing, for example, failure for travel for trainers is another instance which has arisen from COVID. Mm-hmm. We're also looking at this from the background where we have wide collaboration between different countries. So now, looking forward, what lessons have we learned from this COVID that we can translate into offering a quality education across different frontiers in the era of COVID?
Okay. Dr. Shi, so who do you think from the Xi'an University can help to address this question? Or do you have the translator to help you maybe translate a little bit?
Yeah.
Okay, thank you. Mm, 都可以，您看是您来说，或者是
Okay. Yes, and again, now we should do something to prevent disease. So the many meetings and we hold on the line. So rarely we have the offline meetings. So in case and I mean, and many the meetings and also the conference we'll have in the online, and so really we have the meeting and all the people gathered together.
Yes, especially in a global challenges like this, international cooperation and also, the importance of solidarity really made us realize this virus and also this disease cannot be tackled with oneself or just one country. That's why, just as President Xi said, that, dialogues, international cooperation, international communication, and also experience sharing are really, really important, right? So I guess that's also the meaning for our dialogue today. So let's now go to other guests. So whoever has a question, you can just start asking them, or you can also raise your hand in Zoom, and so that could let me know if you have a question. So how about Dr. Kwanda? Do you have any question? If yes, please feel free to go ahead.
Thank you very much. Good afternoon, ladies and gentlemen. I'm sure it's almost evening in China now. My question is, how best can the Zambia College of Medicine and Surgery benefit in terms of specialist training? I'm not sure how much you know about our specialist training, but I'll be able to explain in due course if you could help me with this short question.
Okay, thank you. So let's see who can answer the question from Xi'an University. 施院长，您看是您还是曾教授来回答一下这个问题呢？
我们听得不是非常清楚。
Okay, I'm so sorry. So, Dr. Kwanda, because because of this internet connection might not be stable. So, could you please repeat your question first off in a louder manner and also in a little bit more concise manner, so that we can get your question precisely. Thank you.
Thank you very much. My first question is, I want to learn how best the Zambia College of Medicine and Surgery can benefit from this partnership in terms of teaching the specialist programs. In mind, I have electronic platform as the initial stages, and subsequently twinning and exchange programs of our trainees, meaning that if we could probably send our trainees from Zambia to there for a short skills training, and then their Chinese students, if any, could also come to Zambia for skills training in terms of that kind of exchange. Thank you.
Mm-hmm.
Yes, and We have some lessons for the foreign students, and our hospital have the long history the training the foreign students, and also now we have some lessons from some friends in abroad. If you need it, and I think we can arrange some lessons for you.
Okay.
Thank you very much, Prof. So basically what we are looking at those kind of lessons so that as we train our students, we train them at the same level as the international community is training, so that this can be an all-round kind of specialist once released in the world to practice. So I think we are interested in the kind of training arrangements that you have, especially the short course summer lessons.
Mm-hmm. And also our other professors in Canada, Professor Wei, Professor Zhang, Professor Liu, if you have any ideas or you have any opinions about the questions that have been raised by our guest in Zambia, I can also feel free to add your opinion. Yes, Professor Wei, you have something to share with us, right?
Yes, can I add on a little bit?
Yeah, of course.
I think right now we have more channels to communicate. For example, traditional channel that one country would send students to another country. And right now we can do the online training, and we can also do kind of joint online training. And people are more kind of acceptable to this kind of training. That are the new opportunities. But on the other side, we have to rethink the future. For example, how we are going to design the summer programs. Traditionally, we have summer programs taking students from, for example, from Canada to China, from Canada to Zambia, but right now we cannot do that. And then we have to rethink even some new ways of providing the training or conducting the research. I think COVID is going to change the future, so that is not only for now.
Mm-hmm. Right. So thank you so much, Professor Wei, for sharing with us your ideas on this question. And now, yes, Professor Wang, yes, I saw you raising hands in Zoom. Do you have anything to share with us, or do you have a question to ask?
Yes, if I have a number of questions, I don't know how much time I have.
But you can just start with one.
This is the most important one, most burning one.
Mm-hmm.
Currently, I'm leading a COVID-19 research program in Canada, mainly dealing with Chinese communities. And I launched a survey, basically ask people's opinion in terms of during the peak of pandemic, what did they do to prevent they get infected? And very surprised among Chinese immigrants in Canada, almost half of people said they would like to use Chinese medicine. In fact, roughly 40% of the people use Chinese medicine to prevent this condition. So because of this, I'm very, very curious. I'm very interested to know what's current progress, what's current research stage in terms of any research in this area that's able to demonstrate Chinese traditional medicine indeed can prevent or treat COVID-19.
Okay, thank you so much, Professor Wang. So let's go back to Xi'an Jiao Tong University. So Dr. Shi, as Professor Wang just said, that traditional Chinese medicine has played a very, very important role in treating patients with COVID-19, especially in China. We have been able to combine the traditional Chinese medicine with the Western medicine and also other ways of treatments. So can you share with us a little bit about how traditional Chinese medicine have been helping to treat patients with COVID-19?
Yeah, and traditional Chinese medicine is very effective in this time to overcome the COVID-19, and especially for the mild patients. I think in China, almost all mild patients reach the treatment of traditional Chinese medicine. And also for the summer and severe patients, and the traditional Chinese medicine is also very helpful combined with some other medicine. I think together also get the very good and effect. Of course, now in China, the many researchers do some further research to find the reason and why some herbals and some traditional medicine is effective. And in the future, I guess may have some conclusion for our research result. And also, and in the foreign just Canada and some foreigners, and I think, and at the beginning, and for my patients, and traditional medicine is very effective.
Okay, thank you. So can I have my second question?
Yes, but not very long, right? Because we still have other guests who are eager to ask more questions. But Professor Wang, yes, you can ask the second question.
Yeah, I make my question very brief, and people really want to know what's the current state in terms of vaccine. And currently, we don't have effective treatment, and people put a lot of hope on vaccine. First, and what's the current research stage? And the second part would be how soon we would expect vaccine would be available to be used, for people to prevent this condition.
Wow, this is a really tough question, I guess, because now I guess it's 13 to 15 vaccines that are still under trial and in different phases. Let's see if our doctors from Xi'an Jiaotong University has any idea about the latest development of those vaccines. So, 施院长，您对于目前的这个疫苗的，比如说研制啊，还有一些未来的可能会到这个临床阶段的使用，可以给我们做一个简单的介绍吗
Okay. And I think vaccine is the many Chinese researchers have done much work, and some vaccine is go to the clinical trial, and some I think is the end of the way. And I think maybe it's not a very long future. It will be used in the clinical, but the vaccine and may last how long? I think we needed the time to test, because the various virus that changed very quickly. Maybe in the future, I think maybe our the vaccine and can it and have the effect very long, I think will be checked in the future. And also some the new methods to make the vaccine also is under the way. I think maybe in the future we have the more many types of the vaccine. Some may have the very good effects. I think maybe we needed to test in the future.
Okay, thank you so much, Dr. Shi. And also, Dr. Shi, I know you have a lot of experience in, treating patients with COVID-19, and also you have been fighting on the front line, to fight against this pandemic. So can you share with us, first of all, about some of your takeaways, some of your experiences, according to your experience in fighting at the front line?
是不是就介绍一下您治疗的经验？
对，您能不能先给我们简单的介绍一下您在前线抗疫的一些经历？您觉得有哪一些经验是可以今天跟我们的这些国际的不管是观众还是国际的嘉宾分享的呢？
Yes, and I spent about 2 months in Wuhan and treated many severe patients. I think the first thing we should and carefully to see the patients and to observe the change of the disease, and then to give the specific treatment. That is very, very important. And the second is should to give the very good and nurses and because to look after the patients, and also to pay more attention about and life 这个生活护理怎么说？生活护理啊 ，everyday care, and also and to 人文关怀。
Also, it's enough human responsibility or human care.
Human care, yes, and also human care, and put it together, and it's very important for the recovery of the patients, and also for some very severe patients, and some special measures should move forward is very important. For example,气管插管 trachea and incubation, the tracheal incubation, and if needed, should be immediately give the treatment, and also for the ECMO, and also if needed, should immediately to give, and that's I think is also is very important, because the most of the patients are I think should be recovered and immediately. However, if you lost the chance, the patient will become the severe and severe. So in the early and phase, the treatment and is very important.
Okay, thank you so much, Dr. Shi, for sharing with us your experiences on fighting the pandemic in the front line of Wuhan. And now I'd like to go to Dr. Liu Mingzhao, professor from University of Toronto. So, Professor, I know you have also lots of experiences and also understanding about this ongoing pandemic. So, can you share with us a little bit of your insights on this pandemic? And also, you have students in Canada. So, how do they deal with this ongoing pandemic?
Thank you for the question. And first of all, it's a great opportunity for me to see Dr. Shi again. And we have collaborated with Dr. Shi over the years. And also I feel very much impressed by Dr. Shi as the president of the hospital and lead the team. I went to Wuhan to fight with the coronavirus, and I followed his WeChat message almost every day, and I really appreciate it. It's a great leadership and a great expertise in the fighting the COVID-19 in China. So in terms of the question, I listened to the question from the colleagues from Zambia about the education, about the training. Maybe we can share a little bit of our experience with you. To me, I think it's a great question, but also it's a very much challenging question because the international travel become difficult, and we highly rely on the online training. And for the course-based training, it's relatively easier and maybe even better than in the past to do online. But as we all know, the medicine is a practicing science, especially the surgery. You need to have hands-on, and a lot of things without hands-on, it's really hard to train. So it is a great challenge. And what I can share with you in the University of Toronto over the past 4 months, how we did our lockdown, how we try to recover. So maybe give you some impression about how this situation managed and how that can be managed better. So I still remember very clearly our university, the last meeting I was in the university was March 13th, and today is July 13th, exactly 4 months. So 4 months stay at home. It's really a very special experience for the whole life. But I have to say the 4 months is very busy. It's not a kind of a paid vacation at home. Actually, it's even more busy than the past. So what I can share with you, our experience in the University of Toronto, I would say perhaps 3 keywords what we are doing. Number one is a strong leadership. Number 2 is safety. Number 3 is student-centered. So those are 3 our experience. So first is about the leadership. When the pandemic started, and I think we were not very well prepared. Even though the situation happened in China, we watch what's happening in China every day and worried about what's happening there. But we actually here in North America was not very well prepared. When the pandemic comes, it's really a kind of a sudden outbreak. It's really difficult. So the leadership becomes extremely important. Our university provost canceled her own academic leave and stay on the leadership role. And the dean of medicine immediately returned from his academic leave back to work. Then every hospital, every department, every academic unit have immediately developed our kind of a emergency plan and to make sure that every day there's someone in the place to take an immediate response. And also for every leader, you have to make a backup plan in case the director or the dean is not available. Who will be the successor? Who will be the second successor? So for my whole life, this is the first time I have to choose my successors from my colleagues. It's a kind of a soldier before you go to the battlefield. So that kind of a leadership is very, very important for every institution. And also the coordination between the universities and the teaching hospitals, it really happens immediately. The second experience is about safety. So we emphasize the safety very much. So everything we do is try to protect our students, our staff, and our faculties. So all the education turned to be online. So we had a great difficulty before the pandemic about developing online training, online courses. But immediately when we run into this pandemic, all the things has to be turned to be online immediately. So it's really a big challenge. And also it's amazing to see how quickly within a week, then everything turned from a real person teaching to become online teaching. All the meetings, all the PhD examinations all turned to be online. And it takes time, but the measure is try to protect our students, our faculty, and the staff. So this is a very important. Another thing is student-centered. So we have many students very, very anxious about how to do with their training and with the delay of the degree completion, and especially what I mentioned about the hand-on. So without hands-on, then how can you finish up your research? So a lot of anxiety developed. So what we try to do is we immediately develop town hall meeting with the students and to answer their questions. And we also have scheduled the one-on-one meeting with our leadership with the students. And you may know that in America, there's a big movement about anti-racism. And here it's also in Canada, in rest of the world, students are very much concerned about the attitude of the university, of our faculty, how you guys are doing with the anti-racism. So the students raise a lot of serious concern, and some students even raised their own personal experience to tell us when they were a student in the university, they have been discriminated. So a lot of concerns raised immediately, and which really interrupted the student training. So we immediately call meetings with the student one-on-one or in group. And we also try to encourage the student to take the leadership role to develop research programs on the well-being, to make sure that students help each other, the faculty support their students very well. So I think this is another example. The last example I will give to the group is when the student locked down at home, what do they do? So most of the research and the training are hands-on. Without hands-on, what do you do? So student kind of need some guidance. So what we try to do is immediately organize our student, try to do a literature review. As what I said, even though many papers published by our Chinese colleagues about how they deal with the COVID, and those information were not very well summarized in the Western world. So we try to organize our students to make a working group, try to review by subject how our Chinese colleagues did, and also try to transfer those information to our clinical team. And also we take this as an opportunity to training our students how to collect the information, how to analyze the information, how to write a systemic review on particular subject. So the literature really booming. So when we start in March, there's 1,700 publications, majority from China, but now it's thousands of new publications from different countries come up. So through the literature review, the students learned, and also this helped them to finish their own thesis. So by keeping the student busy, keeping them more educated, and I think we are prepared very well. So I just stop here and to see if you have some questions, and especially if you wanted to know how we are going to restart, then I will give another, I can answer through the question answer. I think I take too much time from everyone. Sorry about that.
No, it's fine. Okay. That's very well said. Thank you so much, Professor Liu. And I think I'm really impressed with the 3 points that you have raised, which is about the strong leadership that needed, and also the safety, as well as student-oriented. And I think this is not only very helpful takeaway, from for the universities, for schools, but also maybe for other companies, who are the businesses who are now looking to reopen and also survive from this pandemic. So thank you again, Professor Liu, for sharing with us your valuable insights. And now I'd like to go to a beautiful lady. So Professor Zhang Weihong, I know you're now in Belgium, right? So can you share with us your observation and also your experiences about, what is the latest going on about the pandemic in Belgium? And you also need to turn on your audio because now you're muted. Thank you so much.
Yes. Thank you so much. It's my great pleasure to be here to see everybody and share some knowledge and experience in Belgium. So I give the full part. First part, I talk just to the health system in Belgium and how to do. And the second, I give some situations, epidemiologic situation in Belgium. The last one, I just try to summarize. So Belgium is a very small country, maybe everybody know, because it's famous, it's hosting the, international organization and also the European Commission in Brussels. So this is a country, it's a federation country. It's, 3 official language, French, Dutch, and Germany. So in Belgium, also it's a difficult between language. So I did my master in the French, so I maybe speak English with some French accent. So how to do, Belgian health system is, is good, is ranking the 6th among 35 European countries because they have the very large vaccination and very, very quickly treatment in the hospital. And also this is, it's a good insurance system. This country boasts 75% your spending in hospital. It's very good. It doesn't matter where you come from, your income and your enrichment and both sides, everybody covered by the, insurance security. Mm-hmm. So I thought how to do the Belgian fits to the fighting. This is the COVID-19 pandemic. So I have to see the strategy for the Belgian to fighting this COVID-19 and to see 4 levels. First level, I could say information collection and analysis. You can to see data collection and the data analysis. Then 3 and 3rd and 4th is to decision making. So data collection, but everybody know information, we can to see by the hospital, by the research institution, and also by some the transmission disease reporting obligation. The data come back in the national institution, they do analysis. By who? By the scientific people. We call 2 levels. Risk assessment management. Risk assessment group. This is the people from the, the we can do professors and students and research. And also then they give the risk management group. That's the risk management group. In addition, the scientific, that's Minister of the Health join, policymaker join this group. Then they report, this is why we go to the level, is the federation level. First, we take the decision, that this is a health situation. But the higher level is the federation level. When they take the decision, not just take into account health, also take into account the social, economy, and politics. That's the final decision. So what we see, this is Belgium. The strategy they fit to the fighting the COVID-19 required because Belgium is a small country, limited resource. We try to not access healthcare system. What this means? This means we keep the hospital, not the not his within limit. So what we could do, first things we have the we stop all the another consultation or the treatment, no urgency in Belgium. That also increase IUC, intensive care unit, the bed. This we try to do. So only the severe patient go to hospital. Another people just has the home isolation by self-isolation. So what people do, so epidemic situation may also talk with you the testing strategy. Actually, the testing for the PCR is the increase capacity. From beginning is 2,000 per day, then increase 5,000 per day, and then the 10,000, most, it was 25,000. For the moment, you can, of course, you test more, use more diagnosis cases. For the moment, I give some, maybe just give some figure today, for the moment, we have 16,000 confirmed cases. So for the epidemiology things, we can to see the people in the infection, the trend, the distribution by age and sex. So infection, infection cases is most female than male, but severe cases or death cases is male is most than female. And also for age, you can to see the age is a trend distribution. Beginning is a normal distribution. That means between 13 and 16 population is normal most. But with the progress of the epidemiology, more old people get the disease, confirm the disease. So you can to see for the moment, near the half of the population is aged more than 16 years old. So the study is successful. For the ICU, the occupation never more than 15.6%. For the moment, is controlled the situation in Belgium. You can to see also for the moment you can see the population the testing is among 1 per 10 person tested by the PCR in Belgium, and positive the COVID is for the moment is 5 per 1,000 in the current situation. So that's it. I talked for the young. But the people, maybe I think a lot of people see the publication, the Belgian small country, but more higher mortality. But I think so you should be careful in reading this publication. In Belgium, we count the deaths not only in hospital, outside hospital. What it means, outside hospital, maybe at home, most of them is the nursing home. Everybody knows nursing home. But also among this nursing home, most of the deaths from more than half from the nursing home. But only 23 these cases is confirmed cases. That means before they go past, they testing positive. But more than 2/3 that do not diagnosis. So, but anyway, because Belgium is a very good health system, they can get the effective number of the deaths is all count. So just I talked with you all this figure they published every day. So I talked today with you just my observation observation every day to see.
Okay.
So let's give some means to here. Maybe as I mentioned, Belgium is a small country, it's good health system. As the strategy is successful, hospital, yes, because it's under control.
Right.
But also need to see how do you say, I want to see between country, comparison between country, we should be careful. Also, as I talked with C, this can be kept the difference, definitions, the difference. That's the talk with to you. What is the number of the dies in hospital, out hospital, and also each country, you need to keep the balance between the health, economy, political, and well-being people. But more important, collaboration. This is what I will talk with you. Thanks.
Okay. Thank you so much, Professor Zhang, for this very comprehensive sharing about the situation in Belgium. Thank you so much. And now I would like to go to Professor Wei Xiaoling, who's now in Canada, right? So, Professor, the situation in Canada in a couple of weeks before has been kept worsening. How about the situation starting recently? Is it getting better? And what are some of the observations and also experiences that you can share with us today? Sorry, Professor, you need to turn on the audio. Yes, thank you.
Okay, thank you very much for having me here. So I want to just go quickly about what is the situation in Canada and what are the problems we have faced. So if you look at the epidemiology in Canada right now, it's Canada has experienced a peak in April, in March, April time, and right now it's going down very quickly. While comparatively other countries like for example, China has a very low death rate, case fatality rate, and a very low kind of case per million people rate along the time, as well as Japan, Singapore, etc. So Canada is doing better compared with European countries like Italy, France, UK, etc. And Canada is doing much better compared with its neighbor, the United States, while U.S. case is jumping up right again. So that gave us, the first lesson we can learn is that every health system has to learn from others. Even the health systems are better rated according to all kinds of indicators have to learn in the COVID period. So if you look at Canada, I think the Canadian most of cases are accumulated in Ontario and Quebec, and the case distribution in Canada is similar to other countries that the disease impacted more on the elder people, on people who have underlying clinical conditions like diabetes, cardiovascular disease, etc. And another factor here is that in Canada, the death rates from long-term care facilities, from older people who are taking care in the care homes, accounted for over 50%, sometimes to 80% in some provinces. So that accounted a big number of deaths. So Canadian government has acted very proactively to protect the population, to mobilizing resources to the medical sectors. But still, there are several lessons we have to learn. I think the first lesson is how to coordinate well in a federal system. Canada is also in a federal system. In the federal system, the federal government, which at the national level, has to coordinate with the provincial government regarding resources, policies, etc. So it works very well in terms of daily healthcare management because it has divided the responsibilities very clearly. For example, most of the policies, most of the money for healthcare came from the provincial government, not the national government. But under this kind of emergency, it really needs a strong coordination body at the federal level to collect all the data, to provide the policies, and to mobilize resources. So Canada suffers a lot for that. For example, Canada does not have a strong body, public health body, as the CDC in China, or even the CDC in America. So Canada relies on the policy at each different provincial level. And at the provincial level, they're always not a very strong CDC. So the public health agencies are under either provincial or municipal jurisdictions. So sometimes even the provincial chief medical officer cannot collect information at the municipal level. So that is one thing. It's about coordination. Is the most important thing. The second thing that Canada did not respond quickly to the public health challenges. For example, in Canada, the first cases was reported on the January 25th, but Canada and the WHO declared a pandemic on March the 11th. So there was, at that time, there was lots of discussion in Canada that the risk to Canadians were very low, and there was no need to put on a mask, and there was no need to avoid public gathering, etc. So until the March 13th, Canada began to issue the travel restrictions, but it still allowed US citizens travel across the border. So by the March 21st, so that has been over 2 months, almost 2 months since the first cases was reported in Canada. Canada began to close the border with US and began to implement a very restrictive travel ban. So if Canada implemented these measures earlier, things will be much different. So if you look at China, China has controlled the outbreak very quickly within the province of Hubei. And if you look at other cities like Shanghai, like Shenzhen, Beijing, the total reported cases less than 1,000. While in Canada, Canada is still had a similar role of suffering from imported cases. Canada reported over 1,000 during March and April. So that's the third, I think the third lesson is to we need to boosting the capacities of testing and PPE, the personal protection equipment, very quickly. So Canada suffered a low capacity of testing in the beginning. And while Canada began to expand the testing capacity from the provincial laboratories to the hospitals and the private laboratories later, and slowly kept ramping up the capacity. And also Canada did not have enough personal protection equipment. So people, even the nurses and doctors, were asked to wear the surgical mask until it was wet. So it was a real danger for hospital transmission in the beginning. The last experience, I would say that we need to think carefully about how to protect the most vulnerable population. So the population will be elders in the long-term care homes, and homeless people, and people who have underlying medical conditions. For example, if you look at the number, the proportion of the deaths in Canada, is that 80% of all the COVID-related deaths in Canada happen in the long-term care facilities. So if you look at policies, so Canada was slow in issuing the policies regarding, for example, we should ban the visitors to long-term care facilities. We should frankly testing people who work in the long-term care facilities, and we should provide more funding and training to people working in long-term care facilities. And those policies were not in place when it needed to be. So if you look at other countries, in the OECD countries, for example, even Italy, the Hungary, Netherlands, Australia, Slovenia, they were all much better than Canada because they have these policies on stage at an early time. So I think by the end, I would say that learning of these problems and learning from these experiences are very important for the future, as we are looking, probably we're looking for the second wave. Canada, for example, Ontario is now on the phase 3, which means that restaurants, the hair salons, they're all open, but have to keep a social distance. But we have observed a high surge in United States. So the policies of putting masks on, which is less political in Canada compared with US, I think that is a very important factor. But we also need to look at policies as different sectors of healthcare and the society.
Yes, thank you so much, Professor, for sharing with us your observation and also about the latest situation in Canada in fighting the pandemic. Thank you so much. And in your speech, you just mentioned that in Canada, there's not an equivalent organization of CDC like what we have in China or in the United States, right? And the power is more kind of distributed in the provincial level. But as you said, in China, we luckily have an organization in CDC to handle or to deal with crisis and challenges like this. And today also it is our great honor to have an official from the CDC system, is Mr. Chen Zhijun, who's the Deputy Director of CDC in Xi'an. So now how about let's have Mr. Chen to share with us a little bit about the role of CDC and also some of the practices that you have been carried out and also CDC in Xi'an have been carried out to fight this pandemic. Thank you so much, sir. Please go ahead.
Yes. And our prevention and control strategy consisted with testing, tracking, isolation, and quarantine. And COVID-19 nuclear acid tested were applied in all the immigration personnel. And those who were positive were sent to hospital for treatment. And all the personnel overseas that come back to China were isolated in a single room for 14 days. And it is very possible to carry out a wide range of nuclear acid tests. And it is not necessary up to the central government. Yes. And for the domestic and local new cases, and we tracked down their close contacts and source of infection through epidemiological investigation. And the corresponding measurement will be conducted, including disinfection of the infection source and isolation of the close contact. Yes.
Okay, thank you so much, Mr. Chen, for sharing with us about some of the measures that have been taken by CDC in Xi'an. And now I would like to go to Professor Wang Peizhong. And also, Professor Wang, you are in Canada as well, right? You have some special observation, which you have shared with us a little bit earlier about the Chinese community in Canada, about their low infection rate. So you think that's part of the reason that contributed to the traditional Chinese medicine, right? Professor, sorry, you're now still muted. You need to turn on the audio, please. Thank you.
Unmute myself. Okay. So I would like to share my observation and my research regarding the Chinese community. And I have to say in Canada, there are many ethnically very diverse, and the Chinese community is a lot, account roughly 5% of the population. In this pandemic, Chinese community overall in Canada has made significant contribution. First, we started early. We reacted very early. Because we just translated the lesson we learned, the observation we learned from China to Canada, and we actually engaged self-protection and education, promotion, donation, all these kind of activities, and we share our experience. As a result, and overall the infection rate in Chinese community is lower. If you look at the results from United States, yes, it is true, a significantly lower even the white population. In Canada, quite similar, quite the same. And even before Dr. Xiaolin Wei just mentioned about self-protection, wearing face mask, we introduced this on April 2nd, but long before that, based on our research, in fact, Dr. Wei is also part of the team, we observed even before that, roughly 90% of Chinese people already started wearing masks. It's much before. And not only that, because at that time, the Canadian government did not introduce self-isolation quarantine procedures, but we realized the danger if someone gets infected, maybe transmit to the other people. The Chinese community mobilized their own resources, form a mutual support group. This means if you come from foreign countries, regardless where you are from China, from United States, we ask you stay home, and the Chinese community mobilize, provide whatever support, for example, running an errand, buying grocery, even some people cook a meal. In Canada, very cold in March, in February, some people during the cold winter, and we mobilize over. This made some very significant contribution. And now we are in the stage to try to summarize our experience. We want to share our results. And one of our co-investigators of this team is Dr. Guowei Zhang. And his research is try to summarize, try to disseminate this information and hope to make contributions to support second wave case. This is very important. This is something I would like. I feel proud of that, and I want to promote the Chinese community in the international stage.
Yeah, okay. Thank you so much, Professor Wang. And now I saw Dr. Michael Babigo. You have raised your hands in the Zoom system, right? So, sir, if you have anything to share with us or anything that you want to ask to our guests here in China or other countries, yes, could you please turn on your camera and also your audio, please? Thank you. Dr. Babigo, are you still with us? Yes.
I can't turn on the camera because I think it was turned off from that side.
Oh, okay. Then you can
my audio is, yes. Okay, you
Okay.
can see me now?
Yes, we can see you now.
Thank you. Thank you very much for affording us the opportunity to be part of this meeting. As you got my name, I'm Michael Mbambiko from the Zambia College of Medicine and Surgery. I don't know how the organization was done, but we are a specialist training college. We train medical specialists in Zambia. So from the beginning, from our point of view, maybe there was some miscommunication, I'm not sure. We thought we would discuss issues to deal with the training, specialist training, and how we can collaborate. Nevertheless, I think the discussion has been more on COVID and its impact than one of my colleagues, actually both of my colleagues, had tried to raise issues about training in this COVID era. So that's our interest, really, on how we can continue training in this COVID era and see how we can cooperate between your institution and our institution. The gentleman from Canada, particularly the professor from University of Toronto, if I'm not mistaken, his discussion was like more what we're interested in. Probably this is an opportunity for us. Maybe we can link up and talk about how they are managing in this COVID era. I think we can learn one or two things from them.
Okay.
Thank you for the question. I think one-on-one hands-on training is still a huge challenge. So what I can share with you is the attitude of our university in terms, especially the international students. So we pay great attention to international students, and we hope that many of our international students could return and or could come as a new student. But the challenge is the travel ban. So no one knows when the international student will be able to come back to the country. So I think for that part, we try to arrange our international students to go on to online learning. So to prepare them if this course-based research, course-based training. But even for the hand-on training, initially we'll try to encourage them still registered with us to be our international student, and we will try our best to offer whatever available to them. So this is one I can comment on. Mm-hmm. And in terms of the ongoing student, the student in Canada, and we realize the interruption of their work, especially hands-on work. So through the reopening, we did a so-called phase 1, phase 2, phase 3 arrangement. So we start to arrange small percentage of our students go back to the research laboratory or go to the clinical site. For those students, we try to make sure, number one is safety. Every student come back to work will have to be very well managed to make sure that they are safe back to the working environment. So there's a lot of measures have developed. For example, there's a self-reporting system. There's the personal protective equipment available to all the trainees. And also there's social distancing. So for example, in any particular room at any particular time, initially it cannot be more than 1 people. Later on become more than 2 people, but the 2 people will have to keep a distancing, and also will have to wear mask, and also try to avoid people-to-people interaction. So we increase the research to, the working at the multiple shifts. So instead of the regular 8-hour shifts, now we have several time fragment. So people can come to the morning, then leave, then second group can come in the afternoon, then leave, then the third group can come in the evening. Mm-hmm. So, and also we open the facility in the weekend. Some people can come through the weekend. So in a way to rotate their use of the facility for their training. So now we start from last week, from July 6th, we move on to the second phase. So 40% of our trainees can coming back to work. So everything is still testing. So overall, what I can say in Canada is much better managed than in United States. And also in the academia, in the hospital, and in the university setting, I think it's much better managed than in the society. So the society still difficult. People may see some news, some people, young people going on the beach to the park and to have a party, but in the educational institutions, I think those situations has been very well avoided. So I'm not sure if I answered your question, so you can discuss. So I will be happy to answer more.
Okay, thank you so much, Professor Liu. And sorry, I would like to introduce to you a guest that just joined us today is Dr. Victor Mukanka, who's the Dean from the School of Public Health from Levi Wanawasa Medical University in Zambia. So thank you so much for joining us, Doctor, because I know you were in an emergency meeting about this COVID-19 pandemic. So let's now turn to you. Do you have anything to share with us on this pandemic, about some of your experiences or insights, and also do you have any questions for your international counterpart here? Please feel free to go ahead, sir. Sorry, you're now still muted. You need to turn on your audio, please. Dr. Mukanka, you need to turn on your audio because now you're still muted. We can't hear you. Or
hello, can you hear me?
Okay, Dr. Mukanka, you're talking, right? Now we can hear you. Okay, I'm not sure. Maybe doctor is having some difficulty, technical problem connecting with this. We can go back to Dr. Mukanka a little bit later. And I know, Dr. Stella, you actually have also something to share with us about the situation in Zambia, right? On fighting the pandemic. So can you share with us a little bit on that briefly? Thank you.
Not really about the pandemic. Mine, like Michael, Dr. Mbambiko was saying, was really to discuss about the specialist training program. Professor Mukonka will share about the pandemic and the response from this end, what we're doing in terms of managing that. I'll leave that for Professor to share. We are managing with the specialist training program and are trying to have the population as access specialist health services wherever they are, where they are, when they need them. That is our focus. So even in trying to fight the pandemic, I suppose, ours is to approach it from having people access quality health services when and where they need them. So you find that our college, the trainers, the students that we have are spread out right across the country. And in doing that, we then make it possible to improve the quality of the health services that people can access in their location. That is the strategy from the college.
May I ask you specifically, what kind of trainees you are mentioning? Are they medical students or residents or the current practicing physician? And how big is the capacity? For example, you are training thousands or tens of thousands. What is the capacity?
Thank you. Thank you, Prof, for that question. So we are training medical specialists. So we have registrars in training. Our capacity for training is 625 students, but currently we have 400 students on board. You might want to know this is the third year of our college offering specialist training. That we have on average, therefore, 130 in the different years, 1 up to 3. Our programs, all but one, run for 4 years. We currently are offering 16 fellowships across the country in 18 training sites. Of the 10 provinces in the country, we are using 8 for specialist training. So you see that we have a wide range in terms of reach right across the country.
So then what is your major challenge? Your lack of a trainer or lack of the person-to-person interaction? What is the major challenge so far? Or is the lack of the expertise for COVID-19, or what is the challenge?
Challenge really stems from us being in our infancy. We are quite new. This is just the third year that we've been. So if we talk about challenges, you can look at them in terms of the institution, which we are using for training, challenges for students, challenges for trainers, and challenges with regards to central administration. And if you look at each one of those, for example, the hospitals that we are using for training, most of them, before now, did not have registrar positions for training. So you find that even in capacities, there's limitations there with regards to administration, with regards to clinical equipment and support services that are supposed to use for training, but also even with regards to facilities for training, because this is still being built up. We look at the students, again, the same challenges, but for students, resource to equipment, resource to educational support, and for trainers, that is one of our key issues. For trainers, yes, one of our main challenges is that we have few numbers of trainers. There are some areas where there's only one person, and then we find also the linkages with our students is also a big challenge. We also have identified some competencies that we'd like to build within our trainers, and I think this will call for further training for some of our trainers. The college administration is still in its infancy, so we're still developing policies to do with the operations of the college.
Yeah, I think
those are the many challenges that we have.
Yeah.
I think, first of all, you should be congratulated for such a wonderful program. I think this kind of program will really enhance the trainees' experience and to bring people to a real hands-on experience. So I guess the interaction between your training program and the Chinese medical universities perhaps will be very suitable for the situation, because Chinese universities has a lot of resources maybe can help. But also I think we have in North America, I think you must know, very successful the specialist training program for many decades. So maybe this could be an opportunity to develop multiple dimensions. So from Africa, from Asia, and from North America, we can work together to share some experiences, share some expertise, and share some resources.
Okay.
Thank you, Prof. And that is what we are looking for, really.
Yeah.
Ways and areas of collaboration so that we build this.
Yeah, it's good direction. It's a really good, it's a good challenge, a good question to have.
Okay, thank you
So
so
I
much, gentlemen.
want to talk a little bit more on that, remote training.
Yes.
So remote training would be, I think that will be the new normality in the future. So I want ask from the questions from the Zambia side. Do you have any facilities to support remote training? So the remote training will be, for example, we can have this kind of training on the Zoom, but then later we need to get the hands-on monitoring and the feedback for the trainees in the facility, in the house facilities we are doing. I think right now in China, China would have the facility to support remote training, as well as the people from North America with quite a good linkage with China, we can also have in this process. So I just want to understand from your point of view of the remote training, and how do you think that is feasible and practical in the future?
How about we ask that question to Dr. Mikanga, who just joined us, because you haven't got a chance to talk, Doctor. So, yeah, do you have any idea about this remote training program that has been going on in Zambia, and also some of the other insights they can share with us on fighting the pandemic? Thank you.
Thank you very much. I hope you are able to hear me now.
Yes, we can hear you perfectly now.
My sincere apology for a bit of the delay. There was some emergency regarding to the COVID. I want to start again by appreciating and saying thank you very much for facilitating and beginning to engage. Certainly, I take the words of Jonathan in terms of the key areas we need to collaborate. You are aware our system, what we are designing, is not to have centralized the training, but spread across the country. Two, we want to do quite a lot hands-on. So I am the dean in our medical school, the Levi Mwanawasa Medical School, but I'm also the director for the Zambia National Public Health Institute, which is equivalent to America CDC or China CDC. And the idea is to marry the two so that those training in public health, they have the grounds where they can have hands-on experience into the field. So the plan basically we have is people working at the institute so that they have their positions also in academic, and the ones in the academic also be part to the institute. And then the students, they can have the classwork, of course, in the university, but also have practicals within the whole range of across the country as we do the disease intelligence and surveillance. Now, it's related to COVID. You are aware almost every African country has been hit. And the situation right now is in the last two weeks, I think the cases have gone quite rising because this is our winter. So we've seen a rise in the cases. So it automatically affected our operations regarding education. We had to close the schools, the universities, and the colleges, but we have proceeded to open for those in the final year or the exam classes and see how we go through the cold season, but also learn before we can open. So the critical thing right now is how do we survive, taking into consideration the COVID, so that academic activities are equally taking place, but in a secured and safe environment. And these are some things we can learn. Then long-term collaboration we want to see both for the students, for the lecturers, and certainly topics. We can have short visiting lecturers. We can also have quite a lot with the technology now through Zoom and so on, the various platforms, which we thought that would create a lot of benefit. And then, of course, is the issue of twinning. I know that you're well established. The other side there, we're just beginning. And for us, the approach we have taken is that looking at the past, where we have a very critical manpower shortage, both the numbers and the skills, we have taken it on in terms of increasing on the production. We look at it as manpower development as a key ingredient to our economic development. And the only way we can do and get the numbers we need in the health sector is looking at the production line. And based on that, that's why we've created all these initiatives. The other we look at it is through the centralization, decentralizing the training into the various corners of the country, automatically exposes our students to more cases to have a better experience. Secondly, it brings the senior colleagues to be around the country, which means we equally improve in the service delivery. So this mode, I think, is working very well. But of course, we are still in our infancy and we need quite a lot of collaboration. The other, of course, we are looking at is in research. There's quite a lot we can do together, which can link both the students and the senior staff. There are a lot of areas for collaboration in research. So in a nutshell, we are looking at capacity building, looking at accreditation systems, looking at train of trainers, looking at areas of collaboration for research, looking at joint program design, development, and then moving into examination processes. Yes, so I'm not saying we do everything at one go, but I think we can put things together in a strategic manner. We say what are the low-hanging fruits we can do now, what are the medium, and then the long-term relationship.
Okay, thank you so much, Doctor.
Thank you.
Thank you. And finally, as you just said, that now actually the pandemic has brought so many changes to our lives, to our, education, and also many other fronts in our development. So finally, I would like to ask Professor Zeng Ningxia, so about some of the changes now that are now undertaking, and also some of their observations and also experiences learned from, the outbreak this time. 所以曾教授，您能不能最后简短的来给我们分享一下，就是在这次新冠疫情当中，您对于不管是公共卫生还是教育体系，这个当中发生的一些变化，您自己的一些看法还有思考呢？
是这样子的，因为这次的新冠疫情呢，因为我们这个公共卫生呢也是在这个疫情的防控中呢也参与了非常多的工作，所以这个时候呢，我们就对这个公共卫生这个体系的教育呢，也就有一些很深的感触。公共卫生呢，其实是我们医学教育体系里面的一个非常重要的组成部分，但是多年以来呢，我们都是重临床轻预防。那么最明显的一个例子，在这次疫情当中，我们在疫情初期的阶段，包括我们的医护人员自己的防护都没有做好，那么造成了医护人员的感染、院内的感染，甚至引起了社区的传播流行。那么也就是说，在医学生的教育这个体系里面，我们把这个大健康的概念呢，并没有贯彻得很好。那么也就是说，公共卫生呢，它是从群体的角度来做疾病的防控，而临床呢，它是从个人的角度来进行救治。大家的目的是一样的，都是为了人群的健康，虽然它的侧重点不同。那么在医学教育体系里面，怎么样把这个公共卫生的理念贯彻进去？我觉得这个是我们整个医学体系教育里面需要思考的一个问题。
好的，您先再听一下。
那么从我们现有的，
我们先让翻译老师帮我们翻译一下您刚刚的这段话，好吗？然后您再继续。谢谢。
Everybody knows that public health is a very important part of medical education system. But over the years, and even at the moment, and we emphasize clinical practice, but make light of prevention. This is always a problem. And during the course of COVID-19, in terms of the public health professional teams, it is seriously understaffed. And we know that the general health concept is very important. It should be emphasized in the educational system of the medical science. And actually, in terms of individual patients, clinical practice is important. But for community or mass, in terms of mass level, prevention is the most important thing. Although the common target is the same, but in terms of individual patients and the mass patients, we have different emphases. And we know that in the educational system of clinical medical students, public health and prevention are closely related. This is a weak point in our educational system. During this course of pandemic or COVID-19, many of our medical workers are not very well protected, personally speaking. And they are infected. And then the inside the hospital infection is very serious. So I think that we should pay special attention. We should enhance measures of public health prevention medical courses during our teaching, especially during emergency. The personal protection, especially for the medical workers, are very important.
曾教授，您请继续。
现在呢，就是从公共卫生教育的这个人才教育的这个状况来看吧。首先，这个体量不足，这是毋庸置疑的。 另外呢，就是我们的公共卫生人才的培养，它的目标定位呢也是比较模糊的。再加上现在公卫人才的流失非常的严重，所以保证这个公共卫生队伍的这个稳定性，真的是一个雪上加霜的这样一个现状。而且我们现在整个的人才培养、公卫人才的培养体系结构呢，也是两头不足。也就是说，基层人员的公共卫生人员严重不足。另外呢，高水平专业人员呢也是缺乏的。那现在这种时候呢，我们就需要重新来定位我们公共卫生人才的这个培养模式，就说我们把这个实用型的人才培养要放在首位，因为公共卫生呢就像一个人类健康的一个大坝。那么我们公卫它是在人群这个疾病防控里面呢，它就像起到了一个限流的作用。如果我们这个限流没有做好的话，每个国家的这个医疗体系它的承载能力都是有限的。那么当滚滚洪流而来的时候呢，对我们的整个医疗体系呢就是一个非常大的灾难了。所以公共卫生一定要住得扎实，要把这个体系要做好。那么基层人员的培养是非常重要的，也就是我们所谓的实用性人才的培养。而现在我们整个的体量只有18万每年。
And the real situation, to the best of my knowledge, is that the size of public health professional training is far from being enough. Also, the problem is that the training target is very ambiguous. The serious problem, again, is with us in terms of the brain drain in the area of public health professionals. And we have two serious problems. One is that the basic level professionals of public health are seriously understaffed. And also we are in great need of high level professionals of public health. It will, of course, take a long time to improve this situation. And we believe that the public health system is the first defense. It's very important. It's the solid foundation. And we should emphasize the application professionals of public health. They are professional medical workers in, of course, the first front. And also, we should pay special attention to prevention of professional medical students. Although the training have different emphases, I think for bachelor's degree students, application type professionals are much more important. Above the master's degree level, we should emphasize the comprehensive abilities. We should train the high-level professionals in this respect. And so this is briefly my idea.
我还想说一点呢，就是关于这个实用性人才的培养，因为在这次的疫情防控里面呢，其实就有我们的疫情的研判，其实很重要的要依赖于流调数据的这个准确性。那么对于这个流调人员呢，就是我们最需要的，在疫情防控的时候最需要的这种实用性的人才。他们不仅需要这种专业的公共卫生的知识，还需要有良好的沟通能力，当然还需要一些其他的相关的知识，比如说法律法规啊等等各方面的。那么我们需要通过这个流调来弄清楚这个患者的来龙去脉，摸清楚他的传播链，这样才能去产生针对性的这种措施，阻断这个疾病的传播。所以这种流调人员在我们这次的疫情的这个对抗疫情的过程中，我们的流调人员是非常的有限的。那么到目前为止呢，这个流调人员呢依然在工作状态，因为没有人能够去替换他们。那么到现在为止呢，就是我们现在整个国内它的本地的这个流行呢已经控制起来了，但是我们依然有国外 境外输入的这个风险，依然有那个小规模爆发的这种风险，所以流调人员依然在工作。而这个流调人员的缺乏，就是到了现在几个月的时间了，我们的流调人员依然还是那一拨人，连换的人都没有，所以就可想而知我们的实用性人才有多么的缺乏了。另外呢，就是高端人才我们依然缺乏，我们没有公共卫生专业博士。当然，希望这次之后呢，我们能够拿下这个学位，这个学位的这个要求吧。另外呢，就是我们如果想培养高端的人才的话，我们一定要需要一个非常过硬的师资队伍，我们公共卫生人才的师资队伍。那么这一次的疫情呢，其实也给了我们一个非常好的一个机会，就是队伍的锻炼。也就是说，我们整个的这个团队在参与到省市两级的这个疫情防控的过程中，我们参与它的疫情的数据的分析和研判，所以我们整个的这个人员呢，它是有不同的，各有分工，有做大数据整合的，有做那个疫情那个预测的，有做那个聚集疫情分析的，有做什么时空趋势模型的，等等等等，就是各个人各有专攻，然后通力合作，我们呢及时的去给政府的决策部门提供我们的疫情分析的结果，同时还要把这个结果呢转换成易于理解的这种信息，让我们的决策部门能尽快的做出应对的措施。所以整个的这个过程中，对于队伍的锻炼呢非常的重要。那么这个也就是说，对于公共卫生人才的培养，它是面对人群的，所以它一定是一个系统工程，它一定要去在实战中去锻炼我们所有的公共卫生的人才，包括去 CDC、去妇幼保健院、去监督所、去社区服务中心、去检疫中心等等等等，这样才能够为我们以后同样类型的这种突发公共卫生事件的应对储备一个非常好的这个公共卫生的人才队伍。这就是我的一些感想，谢谢。
好的，谢谢曾教授。翻译老师您请翻译。
I think that the training of high-level professionals of academic researchers are especially important. And at the moment, we even do not offer, a doctor's degree for public health, in this respect. For training of doctor's degree holders, we should have a high-level teaching teams, of course. And now, let me emphasize, professional academic researchers should, of course, good at data, collecting. They should also have the knowledge of laws. They should be also good at communication, and they will provide good information, easily, understood for government officials or for the non-professionals to make decisions. So I sincerely hope that from this lesson we learn, in the future, we should offer a doctor's degree in the area of public health. And of course, there are many things important. We should combine all the efforts to make it happen. Thank you.
Okay, thank you so much, everyone. And before we wrap up, I just wonder, Dr. Shi, do you have more stuff to add on?
Yes, may I speak with the Chinese and last? 非常高兴今天很有机会呢，和我们赞比亚的朋友，还有我们很多的其他国家的朋友做了交流。那么后面我想强调几点，第一呢，就是关于治疗的问题。刚才可能因为语言的问题，可能我说的不是很清楚。那么我们对病人的早期干预、全面治疗非常重要。那么这样的话，有利于我们很多的病人得到及时的控制。但是这个治疗呢，一定是一个综合治疗，包括我们中医在内的综合治疗，对于这些病人的及时的治疗，他们的康复很重要。假定如果说病情变化比较重的话，在早期没有得到治疗，有很多的治疗必须要及时的要跟上。所以我们有一句话叫做关口前移，如果需要气管插管的时候及时要插，需要做 ECMO 的时候就要及时要做。
I'm very much honored to be here to share my experience and my expertise knowledge online with all the friends present, friends, scholars, professors from Canada, from Zambia, and from other countries. Now, let me summarize. First, I think that the first important thing is treatment. This treatment should be timely treatment, and also it should be comprehensive. It should be, and if possible, combined with traditional Chinese medicine method, and even some other, of course, possible measure should be also used. This treatment is the first important thing, timely, comprehensive, and systematic.
另外我还想特别强调的，因为这个对于新冠治疗，它是一个综合治疗，也是一个综合科室，就是多学科协作治疗才能取得很好的结果，尤其是一些危重病人。因为呢，尽管这个新冠是一个传染病，但是呢，它所引发的主要的问题在呼吸系统，而且呢，它是一个既危重病人，所以需要我们的感染科、需要这个呼吸科、重症医学通力协作，才能把这些重病人得到及时的救治，取得最好的结果。
The second point, I think very important, is that in the treatment or dealing with COVID-19, I think that cooperation of different departments are very important. Although this is a respiratory system problem, it also concerns with infection, ICU, and the other maybe, of course, possible, departments. So my idea is that comprehensive, cooperation with different departments should always, the most important thing to be considered.
最后一点，我想要说的呢，就是我们学校包括我们医院有60多年的办学经验。那么刚才呢，我也听到我们赞比亚这个领导也介绍，就是在医学教育、培训各个方面呢，还是需要我们的一些合作。那我想我们非常有经验，另外呢，我们还有大量的留学生的培养经验。特别是我们有多年呢开门办学对基层医疗的这样一个培训和支持的经验，再加上呢我们现在有一个非常好的一个互联网医院，也是我想可能是我们第一个真正意义上的互联网医院，因此呢我想我们未来和中非之间、中赞之间有着非常密切合作的这样一个空间，所以希望我们呢继续保持联系，促进我们这个中赞、中非的友谊和医学教育。
Our university has a longer history. Our hospital has a history of over 60 years. And after listening to all the other professors, scholars speaking, I think that we can do some training, some online training. Here, I'd like to tell you something interesting and important. And here in Xi'an, we have an internet hospital. And this internet hospital is something new, something creative. Maybe using that, we can continue our online training. Training of international students, training of medical students, training of doctors, training of in-service, professionals. So I sincerely hope we can do something in this respect.
Mm-hmm.
Thank you very much.
Thank you so much, everyone. And today it is really our great honor to have guests from China, Canada, Zambia, and also Brussels to share with us their experiences, their insights, analysis on some of the takeaways and lessons learned from COVID-19. And as many of our guests mentioned today, that actually this pandemic has brought so many changes, either in good ways or bad ways, to our lives, to almost every aspect of the development in our society. But this also, on the bright side, has also made us realize that we have to work ever closer together to move on with confidence and to also deal with those challenges. So thank you again for everyone, for your time, for your participation, and also a big thank you to you, our viewers, who have been paying close attention to our programs. We have more to come next week. Thank you and goodbye.